it's over.
Huh?
So this time...
I'm hoping I'm going to knock you over.
Oh, thanks.
You said you were doing the room.
Well, you took over.
Emma is over halfway through her 16-week placement at the Princess Alexandra Hospital.
I'll mop the room. You mop the bathroom, I'll mop the room. Deal.
That's fair. The bathroom's much smaller.
Before she finishes, she needs to complete both practical and written work to become a fully qualified maternity care assistant.
So this time you're doing your care certificate, how are you finding it? Because it's hard, especially when you're working and then you've got your kids and they're all around you. So when you're at home, you get up and do it when I'm at home, and then you can't because you've got to focus so much that you actually the kids are all in your ears and you're like, I can't concentrate.
Sitting down and writing and reading, I have to do that for the kids' homework. And then you have your own homework to do as well, and it feels weird because I'm 43 and I did school, it's over. And now I'm doing school for a 9-year-old and a 7-year-old, and then schoolwork for myself again. But what I will gain at the end of it is worth it.
I'm much more of a practical person.
Yeah, me too.
Than a written person. So I know exactly what to do and what's right, but when it's written, the question, I'm like, well, what the hell does that mean?
Yeah. So you do just have to do worst case scenario. If this happened, this is what I would do.
Yeah.
And then, because all they want to know is that you know what to do in any situation.
The care certificate that ball has been dropped. So that is something that I need to pick up now and get done.
Today, Emma will be working with the Elective cesarean team and midwife, Sam.
I've done all of her pre-op bits already, so all she needs now is observations, if you could go and do those. And then we'll go to theatre and brief, if that's okay.
And have a baby.
And have a baby.
Oh,
thank you.
Okay.
Her next patient is 32-year-old Jodie, who is accompanied by her partner, Ben. They have opted for a cesarean section after a traumatic delivery of their first child.
When our first son was born, he was 2 weeks late, so Jodie was induced, and he got in a bit of distress, and eventually she went in for a C-section. It was like a bit of a whirlwind, because once they pushed the button, it was, it was like a big team of people flew in, and they just basically rushed her straight through. They were amazing, actually. Very good.
Hi. How are you? You all right? Can I come and do your obs?
Yeah. I'm actually a little bit nervous. I'm excited.
Yeah.
I'm excited.
Good. Can you pop that under your tongue? Close your mouth. Perfect.
Yeah.
Do you know what you're having?
A boy. Second boy.
Second boy. Oh, you'll be surrounded by boys.
Yeah.
You all right? You know what you're doing?
Yeah.
Yeah. It's like, this is fine. It's all in their days.
Yeah.
Not for you. Although you do know what you're doing.
It'll be a while, won't it?
Yeah, totally. You've done it all before.
Yeah. No, it's
Everything
coming.
will be wonderful.
Fingers
Look forward
crossed.
to it.
Yeah. Right, I'll see you in there.
Okay.
See you soon.
Bye. I think it's always a massive exhale. When you know someone's had a traumatic first birth, and they can really affect you, and they can affect your head, and it happened to me, and I opted for a section the second time because I couldn't imagine going through that again.
On the other side of the maternity department is the birthing unit, where mums who are termed low risk can choose to give birth in a pool.
Margaret, who am I doing notes for? Sorry.
Ricardi.
With 29 years' experience as a midwife, Margaret is the birthing unit manager.
That's his tickle reflex or gallant reflex. So if you do that.
I've worked in all aspects of midwifery in every care setting possible.
Look at you, you're just adorable.
To be at somebody's birth is the most privileged position you could ever find yourself in. It's the most intimate time in a woman's life and her partner's life, and I love it.
Margaret's next family, Dad Jack, mum of two 28-year-old Charlie, and her mum Jan, are just arriving.
So we are just in here.
Charlie's in the early stages of labour and is hoping to have her first water birth.
So, my darling, are we ready? I just wanted to check with you that you were happy to give birth in the pool.
Yeah, I'd love that.
It's my daughter and her partner having the third baby. Don't know what it is yet. We was over this side before with the first one, but we ended up getting rushed over to the other side. So, yeah, it was a bit awful. Hopefully she'll do it in there. You want to splash me?
Oh, God. They really are. Oh, my back. They're getting worse.
What, the contractions?
Yeah.
Well, all I can tell you is they're coming nice and thick and fast. You're the one that can tell me how bad they are. But look how well you're doing.
Fundamentally, water changes a woman's experience of her pain. And the warmth of the pool, the sensation of the water lapping up against the skin helps to release her endorphins. To be born out into water, that won't be so different. That'd be my best way of being born.
Oh, yeah, you think your waters have gone back? Yeah, they have.
Yeah. Just listen to you. What time is all that?
16:16. Yeah.
It was on 16.
I wrote down.
Quiet.
What's that? Congratulations.
Thank you.
There you go.
Oh, wow, that was amazing.
If you get the right lighting, then you just get the bouncing of the light on top of the water. And you see this little one emerge at the bottom, clear water, and they're just going, it's like stargazing. It's just magical. It really is gorgeous.
I've never seen anything like that. Oh my God. That is amazing.
Wow.
I'm feeling really very proud of her. They've done me very proud.
God, yeah. I get to be with a mother and father as their family grows.
That's me, that's us now, no more. Yeah, we've got a little football team now, isn't it? So happy days.
I call it an everyday miracle, and that's why I love being a midwife.
You'll have to take all your outside clothes off. Yeah. Toilet, bathroom, just from the corner. Okay, I'm gonna get you a gown.
Yeah.
Just in my boxes, right?
Yeah. Take those off. Take those off.
Following the results of Jodie and Ben's observations Emma carried out earlier, they have now been given the all clear to have their elective cesarean.
Met Jodie this morning. She ended up having an emergency section with her first baby, and now they have a baby number 2. They have elected for section, and I get to go in and see it. I love it. I love being in theatre.
I hate wearing these red ones.
Why?
Because it makes...
Looks so...
I just hate them.
So
like
attractive,
a moped.
Sarah.
Like a moped.
As Emma will be the only MCA in theatre, it's essential she knows the names of the equipment.
So, in the section pack, which ones do they use?
They use abdo and small.
That's it? Yeah. Yeah, in the delivery packs they have the large.
When they deliver in the room?
Yeah, and
Yeah.
also if they come in here for an instrumental,
Yeah.
when we give them their delivery pack, it is the large swabs.
Okay.
You know what these ones are?
Little Woods.
Yep.
Just read it.
You cheater! Electives are completely different to labour wards emergency theatre. Electives are so calm, whereas whenever you're in theatre in an emergency, it's not calm.
Yeah.
And it's completely different to the way they do things in the electives.
With the theatre all set, it's time for Jodie to have her baby.
I mean, they're the height of fashion. Yeah, go on, why not?
Just for the fun of it, yeah?
We can all look like dinner ladies together. Yeah. If all goes smoothly, it's going to happen relatively quickly. I think with a section, you know, and it's going to be pretty quick, whereas with labour, you've got no idea. You're excited.
Yeah, I am. A bit nervous, actually.
So she's having a section.
Emma's tasks are to prepare the instruments and document each stage of the operation.
Couldn't you have done this?
What, the injection?
No, had you?
I would have, I could have.
Jodie's having a spinal anaesthetic, which takes away all feeling from the waist down.
Right, my dear, sorry if I'm pushing hard. I'm just trying to appreciate the space in the back. Just put the plastic tape on your back.
Okay.
Yeah, I'm good.
Sure.
You can sit down in the chair if you want to. Still please at any time.
No, I'm good.
And I'll try and catch it.
It's just needles.
Here we go. I hope you're grateful.
Jodie is about to have her second baby by elective cesarean. Emma is the designated theatre MCA.
Starting.
I just find it incredible what these guys do. It's amazing. I like being in here a lot. I like watching the process, watching the little dance that they do on this table, like a very slick waltz. Ben keeps peeping around the corner. He's trying to look. You're really trying to have a little...
in trouble, no?
To reduce scarring on Jodie's stomach, surgeons stretched the incision, creating a larger hole.
The first time I ever saw it, I was like, what the hell are they going to rip that poor person into? And then the more you see it, you're like, oh, it's just quite normal. I've been pulled apart like that, yep.
You feel the tugging, can't you?
Yeah, you can feel a pressure and you can feel like a weird sensation.
Yeah.
You can't feel it.
No. You can't feel the
But
pain,
you can
but you feel
it.
pressure.
You can't feel the pain, but you can feel tugging. And, yeah.
Here we go.
Just 40 minutes after walking into theatre, Jodie's second baby is born.
Do you know what? It feels a bit surreal, doesn't it?
So if you pop yourself down, and I'll give them so that it's facing mum.
Yeah, Mum.
This way.
Hello.
Hello.
Congratulations. Well done. Done amazing.
Oh my god, look at his big lips. Really cute noises.
Congratulations. It's so weird what I can see that side to what I can see this side.
It's the weirdest experience ever. I feel everything, but nothing.
So small, isn't it?
I forget.
It's so lovely.
It's good.
Oh, thank you.
Feel
for it.
Well done.
Yeah, thank you.
Another 8-hour shift at the Princess Alexandra Hospital has ended for Emma.
This job never gets boring for me. And watching that moment when someone's life changes forever, it is my favourite thing about doing this job, is when I do get to see a birth, that kind of blissful moment of completeness. It's just beautiful, and it literally melts. I could cry thinking about it.
Who's that?
Baby.
Does he look like you?
Yeah.
Yeah?
A little bit.
A little bit.
24 hours later, Jodie and Ben have brought their 3-year-old son Hudson to meet his new brother.
I'm going to see Jodie and Ben and I think unnamed baby. Haven't seen them yet this morning. And which I thought, oh, go in, see if baby's got a name. Then they were like, take a cannula out while you're there. What? No.
To become a fully qualified maternity care assistant, Emma must remove the cannula unassisted.
Paige, that's all I need for a cannula, isn't it? Yeah. Thank you. Last time I tried to take cannula out, it got very stuck. And the blood had gone all crispy around the entrance. And then you're worried that you pull it off, it's just going to bleed. But I have a feeling everything's been smooth with Jodie. I think the removing of her cannula is going to be smooth as well. Fingers crossed.
Hi.
You're right. Hudson, say hello.
Hi, Hudson.
Hudson, look.
He's like, I've got a baby to be dealing with. Hey, Hudson. Has your brother got a name yet?
Beetle.
Pardon?
Beetle.
He calls him Beetle.
Beetle? That's a great name.
He
Has
calls
he got a
everything
name yet?
Beetle.
You decided?
It's either Forest or Sunny, but
Still can't decide.
no.
How have you been?
Yeah, I feel really good. Much better than last time when I was with him. Much, much better.
Oh my gosh, it's gorgeous.
Very similar.
You are gorgeous.
Very similar.
So he's taken well to it?
Eyes, yeah,
Absolutely
adaptable.
besotted.
I believe I can take your cannula out.
Yep.
Look. It's tiny.
He is tiny.
Does it hurt? Is it alright? I had one the other week and I just couldn't get it on. I felt like I was waxing the poor woman. And then
My hand could do with the wax.
it had kind of scabbed, a little bit of blood had
Oh,
scabbed to the
nice.
entrance, and I felt like if I pulled it out, I was gonna.
Don't make me laugh.
Oh, sorry. I felt like I was gonna just make it bleed again.
I'm pretty sure he's done that for me. All better.
Ta-da!
Hi, Mummy's
All
waving.
better now. Yes. How's he look?
Looks great.
Good.
It's not bleeding. Oh, done. Mummy's got free hands again.
Hit me.
No, it won't.
I'll come see you.
Yeah,
No
amazing.
worries.
Thank
If you need
you.
anything.
Thank you very much.
Take care.
They're such a cute little family. Hudson is so cute with that little baby as well. He's just constantly there, so gentle, stroking him and like rubbing his little head. Oh. Jodie's as cool as a cucumber, super calm. Ben has just got this kind of look of love in his eyes constantly. It's so cute to see.
Next on Emma's rounds is a mum who has just arrived on the antenatal ward.
Nice lunch? Yeah?
Chicken, hummus.
Chicken hummus. No potatoes?
Breakfast.
I know you're partial to a
That's
patata.
breakfast.
Hi, can we come and do your robs?
37-year-old magistrate court manager and mother of two, Erinula, will be induced today, accompanied by her mother-in-law, Anne.
I said my daughter's 13, my son's 10. There's a 10-year gap difference. This was a shock. I come out of a car accident in July, go through MRI, and then to be told 2 months pregnant.
Oh my gosh.
Yeah.
Scans also highlighted an issue with the baby's foot.
Yeah, a new challenge in life. Have you heard of talipes as well?
No.
It's a twisted foot. But it's my husband's got it, my daughter's got it, and I've got it with the third baby. And it's born with a twisted foot.
Talipes, also known as clubfoot, is a condition where the foot twists inwards.
It all depends how bad it is. If it's that bad, then I'm going to leave it to about 3 to 4 months, if possible, and then have it operated.
Right.
At a young
But
age.
they don't know until baby gets here.
That's correct. Yeah, we need to know how bad the twist of the foot is. And then we just deal with it from there.
Are you feeling all right in yourself?
I am, yeah.
Well, you're here and you're in the right place, which is great. And if you need anything,
I will do. I shall shout.
Get it for you. It was nice to meet you both. I'll see you in a bit.
You hear about a clubfoot, obviously, but I've never seen it before.
But it's good to see everything, I think. It's good to have a... I'm not very knowledgeable, but it's nice to know a little bit about a lot. My brain can't keep in a lot about everything. Or even a lot about some things.
Oh, here comes another.
Female.
Oh, God, it's coming. Oh.
2 hours later, Erinula is having regular contractions. She's been joined by husband, Wayne.
When I first met Erinula, I thought, yeah, she's very nice, pretty. Thought I'd give it a go, got nothing to lose, and I asked her out for a meal and cinema and ended up getting married, and the rest is history.
Erinula is being cared for by midwife Zoe.
Happy for me to examine? Cold jelly, lots of pressure. Tell me if you want me to stop, okay? So just some touching now. Just relax his legs, sweet. Well done.
For Dad Wayne, the baby's clubfoot is all too familiar.
I was born with talipes myself, so we know about it. My first daughter also was born with talipes. With that one, we didn't have it operated on, we had it manipulated. So basically, they put different plaster casts, trying to straighten it, just using plaster casts. But with this little one, I think my wife wants to have it operated on straight away, just to correct it earlier on.
You're about 3 centimetres, okay? It's much thinner than it was before, your cervix. So you're doing really well. We're going to go over to labour ward now, and you can have your pain relief there. Normally we wait till the 4 centimetres before you go over. Because you've had 2 babies, it's likely that this is going to progress.
And the going in, yeah?
Well, we've got a few things to do before that.
Okay,
We've got
that's
to put
fine.
cannula and blood.
All right,
and that sort of
quickly,
thing in.
quickly.
Erinula's last birth may have been 10 years ago, but the couple remember it well.
It dragged on a very long time. It was, I think it was about 59 hours in the end it took. But the plan for this birth, it would be the epidural. Yes, definitely, she would prefer that to numb the pain completely. Hopefully that will happen.
Epidurals are only administered on the high-risk labour ward, so Erinula is being transferred over under the care of senior midwife, Nagma.
The biggest baby I delivered, normal vaginal birth, was 11 pounds, 11 ounces, intact perineum. He needed a school uniform when he came out. It was massive. I feel Princess Alexandra is the best labour ward and hospital in the whole world. I have got 2 children. I had them in room 2, both of them in room 2. I remember everything, and that is what you always think, what do the patients remember? It's very important to me, and it's just lovely. I feel emotional. I feel it's like my home in a way. It's my second home, yeah. Because sometimes in the 24 hours, I actually spend more time on labour ward than I do at home. Hello, hi, my name is Nagme. I'm going to look after you, darling. That is your gas air. Could you lean back for me so I can have a feel of your tummy and also put you on the monitor, please? Okay. Just bring your legs down for me, please.
I need that injection.
Now, what I need to do, darling, if you are going to have an epidural, I need to examine you down below to see how far you are. How far were we, Erin? 3. You were 3 centimeters dilated. Let me examine you again to see what we are doing, and then from there we can decide what's the best way. Breathe and blow it. And again. And again, you're doing good. Well done.
Where am I?
It's the gas, darling. You're in hospital, on labour ward. We're going to have a baby. That's it, lovely. Lovely.
Are we still going for the epidural, did we say?
No. Yeah, I'm just going to check you here, darling. And then if we can do it, I will sort that out for you. May I pop a couple of cold fingers gently inside?
I wish I was a bloke.
No, you don't want to be a bloke. Right, you are 4 centimeters dilated.
That's good. Epidural can go in now, yeah?
Right. No, listen. Are you happy for me to break your waters for you?
Yes.
Excellent. Well done. Perfect. Now, pop the gas in your mouth. Pop it in your mouth. Breathe it. Breathe it. Well done.
You can't go.
As the baby passes down the birth canal, Nagma is struggling to pick up the heart rate.
Got a bit of a loss of contact. Right, ready? I'm going to do an examination down below and pop a clip on the baby's head so we can get the baby's heart rate directly from the baby's head. Bring your legs up, pop your heels together for me. Both of your heels, perfect.
Doing well.
If it's just I have to do it because I need to know what's happening with your baby. Flop your legs open for me, gently coming through, my lovely. I'm afraid you're about 9 centimeters dilated, darling. So I can't give you an epidural, I'm afraid.
Come on, darling,
I can't do this.
Come on, you've done it, darling. Almost there. Come on, darling.
I can't. The heartbeat's coming.
It's a very invasive procedure. You can't have an epidural needle in your back and then you've got to start pushing. So you have to then make sure the lady knows why you can't put the epidural in, and it's very difficult for them to actually understand what you mean because the pain is overwhelming.
I can't do it without it. I can't do this.
You can, darling, you can. You can push. Come on, we're all here. You can.
You are 9 centimeters. It is not possible for you to have an epidural because you're going to be pushing when the needle is in your back. And we can't do it. Any minute now, you're going to be fully dilated. We are going to have this baby.
I want to go.
Yes, come on, we need enough.
I'm pushing.
Wing. Gas, don't breathe.
Breathe and blow it. Breathe and blow it. Stay with me.
With only gas and air for the pain, Erinula is about to give birth, supported by midwife Nagma, husband Wayne, and mother-in-law Anne.
Breathe in, blow out.
I'm gonna push.
Breathe it. Your baby is going to be here very soon, darling. That's right. Beautiful. Well done. Well done.
Breathe it.
Right.
Breathe and blow it.
Good. Come on, darling. Doing well, doing well. Breathe.
Nice and easy. Breathe it.
Oh, pushing.
That's fine. Give me a pushing.
Alright, it's coming soon, darling.
Slowly. And this one as well. Give me a push, darling.
Push.
If you feel you want to push, give me one.
I can't.
You can, darling. Come on, you can.
Take a big breath in.
And push. Big breath in.
Put your chin on your chest. Don't blow it out. Keep the air in.
Keep it in and push.
That's it, that's it. Do me one more.
Yeah.
Do me one more, darling. That's the one. Right.
Don't breathe up. You have to, darling.
That's it, that's the one.
That's it,
That's the one.
that's it. Good girl.
Keep pushing.
Keep going, keep going.
Breathe
Breathe.
it. Breathe it. Perfect.
Good girl.
Okay. Give me a push, darling.
Good girl, come on, another push. Come on, no more.
Perfect. Lovely.
After pushing for an hour, the baby is born.
Hi, darling. Mum, can I have another 2 towels, please?
There you go. Good boy.
How long have you been doing this?
This job?
Yeah.
39 years.
Oh, touch wood.
A very long time. Do you think I pass?
Yes, you do pass.
Do you think so? I hope so. Is that what it looked to you?
Yes.
Perfect. Then I'm very, very happy. And they are perfect.
There you go.
Lovely. Right. The rate of talipes in the UK is 1 in 1,000. When a family are already aware that they have talipes, my job is still there to explain, to advise and to reassure them. But nevertheless, you have to give them a lot of moral support. This is the club foot. I am not going to be manipulating it back and forth because it's not going to go. So I don't want to give him that pain and sufferance. But all will be well.
There you go. It's fine.
Lovely.
The next day, Emma is doing her rounds on the postnatal ward.
How are you? Yeah?
Yeah. Done.
You have a baby?
I was here and then
Last time I saw you, you didn't have one. You all right for your obs?
Of course you can.
Thank you.
Baby Tyler is now 11 hours old.
So what happened?
What happened? All my plans went out the window. And I went gas in here. Yeah.
Did you?
I did. It was quite scary actually.
I can't remember what happened yesterday.
It just went too quick. From 3 to 4 centimetres and then went to 9 straight away. There was no time at all. I had no choice just to go gas in here. My fear was it's the pains obviously, you know. Can I get through it? Yeah. I don't know.
What time was it born?
It was born at 1:40 in the morning this morning.
And how's his foot?
I'll show you. Does that mean that that's finished?
Does it hurt him?
I don't think. No, you see.
Yeah. That one you can see. It won't go. But yeah, it's easily fixable.
Right.
So we know what to do with this one.
Yeah. All you want when you have a baby is for it to be healthy and well, and you know, for it to go into the world with no issues, and she knows exactly how to deal with the issue that her baby's been born with, which must be, you know, when you don't know, it's got to be terrifying and daunting and nerve-wracking, but when you do, it's like, okay, I know that I can fix this, I know I can conquer it, I know that everything will be okay. Massive, massive relief.
Baby Tyler will be under the care of the hospital's paediatric department. it may take several operations to correct his foot.
So are you feeling all right now?
I am. Yeah.
Good.
I'm ready to go home now.
Do you know where to go?
Tonight, hopefully.
Well, he's gorgeous. Congratulations.
Thank you ever so much, darling.
Women are superheroes. You know, Wonder Woman was based on a pregnant woman, I have no doubt.